All right, we are recording.
All right, thank you all so much for coming to our first guest speaker event of the school year with Shivani Barrot, who is an aspiring healthcare administrator and who is such a talented individual. And so Shivani Barrot was actually a Piedmont Hills alumni from 2014 to 2015, and she served as the Med 101 president for her year. She graduated from the University of California, Riverside in June 2019 with a Bachelor of Science in Biology. And currently she is a first-year Master's of Healthcare Administration student at the University of Southern California. The past year, she worked as a supply chain analyst and managed the purchasing department of a hospital in the Bay Area. Shivani is very passionate about improving the healthcare American system and hopes to become a hospital director. She currently serves on the Student Health Council at USC and helps to bridge a gap between the graduate students and the faculty of the MHA program. So before we start, if you have any questions in the live chat, feel free to message it and they will be addressed in the last 20 or so minutes of the webinar. And without further ado, please welcome Shivani Barrot.
Thank you so much for that kind introduction. But it's so great to be back here and speaking for PHHS. Like Kirsten said, I was part of Med 101 and I loved every minute of it. And I guess quick intro about me, besides everything Kirsten just generously said. After graduating from UC Riverside, I decided to work for 1 year to gain work experience because, to be honest, and Mr. Vasquez probably knows this too, I loved physiology, I love science, and that's the reason I went into biology in the first place. However, as I went into college, I realized there are so many niches within this field. And that's when I started to get curious, and that's when I started to branch out, shadow people, intern, and do whatever I could to really figure out what is it that I want to do. So that's when I decided to try something completely different, do a total 180, and I decided to try out supply chain at a hospital because that's what was open. And I was like, let me just try it. It's St. Rose Hospital in Hayward, California. So I did that, definitely pushed myself a little because supply chain is, for those of you who don't know, it's budgeting, finance of inventory of hospital supply flow. So like anything from needles, anesthesia, down to like Band-Aids, MRIs, hospital equipment, surgical equipment. So it was definitely a big switch. And now I'm back into school and trying my best to become a hospital administrator. So yeah, and USC is amazing. Go Trojans. So if you guys are applying, if you guys are seniors right now, I definitely recommend.
What kind of got you interested in healthcare administration? I know that you're like so interested in Med 101, but was it Med 101 that kind of introduced you to healthcare administration?
Yeah, so I'll answer that question. So personally, I'll be honest, as I was growing up, we have a lot of pre-meds in my family and doctors. So when I thought about healthcare, I thought of doctors, nurses, physicians, assistants. I honestly, even while I was in Med 101, that's kind of what I knew. And it's not like I was like, oh, I'm not going to be a doctor. It's more like I just didn't know which one I wanted to do. And then as I went into college, actually, it was my second year. I was taking organic chemistry, which a lot of you guys are going to have to tackle in this field. And I realized I was just like, I don't want to do organic chemistry. I don't want to do this. But I still loved physio. I still loved medicine. I still loved anything to do with helping people in this regard. So what got me into this initially was I joined Riverside Free Clinic. And a free clinic, what it is, it's that you're going to be going there, you're volunteering, and it's people who don't have healthcare, can't afford healthcare, are getting free treatment from doctors, medical students, nurses, and it takes a big group and a big professional family to throw this type of show together. And I joined Riverside Free Clinic and I became the nutrition committee head. And I realized with clinical things going on, so clinical as in like talking to patients about their specific health problems, but then going into how do we make this better? How do I help not just one patient? How can we help more patients more efficiently? Those are the type of things I started learning at the clinic. So when I started realizing that clinical stuff and admin stuff are right now like this, but they need to be going together. So when I did clinic, I realized you need someone who can understand both. And that's where I realized I wanted to do healthcare admin because the effect was huge.
That's super awesome. So how did you decide, through all of those experiences, how did you know that that was what you really wanted to do?
Yeah, so with that, then I decided, so in this regard, I was a little bit fortunate. My aunt is a CFO of the MedStar hospitals in DC. So MedStar is a hospital chain over there, and she does finance. But again, I was like, this is the only link I had. I knew no one else in this field at all. So I called my aunt and I was like, can I just come check it out? So I go to DC, stay there for 2 weeks over the summer. And then what I did was I shadowed healthcare administrators and I got to meet so many. And I realized that, like, wow, I love what they're doing. And what they're basically doing is it depends. There's a huge healthcare administration. I'm just talking to you guys more specifically about hospital, but there's so much you can do. There's healthcare consulting, there's management, there's operation, there's project management. So I got to talk to people from all these departments and people that were clinicians, like doctors and stuff, who later on got their MHAs or MPHs and became clinical heads. And so after speaking to these individuals as to why, and it goes back to what I mentioned about how physicians, they have a say in how they treat, but they don't have a full-on control. And when you have healthcare administrators who are willing to sit there and understand them and work together, then you see a difference in your patients. You see a difference in your hospital flow. And I just thought that was really fulfilling. So that's where I decided. It was at Washington, D.C., where I was fortunate enough to have that experience.
So I was kind of reading up on like healthcare administrators. Do you do a lot of like policy changes? Like, does that involve like the FDA or anything like that?
Yeah, so in healthcare admin, like I mentioned, you have a lot of different aspects. You can go into health policy, you can go into a lot of things. So if you wanted to go that route where it comes to working with policymakers and working with government, or just seeing what other things you can do at state level or federal level, whatever, when it comes to making difference and changes, that comes into more, then you're gonna get a similar MHA degree, but you're also you can minor with policy, or you can work like at USC, for example, Price School of Public Policy, where they'll connect you with these organizations. I will link everything in the chat below, or I'll send it to you guys, but there are a lot of health organizations that this is what their main purpose is to change policies. It's kind of like going back to the Affordable Care Act, or Obamacare, as a lot of you guys know about it. A lot of that push, obviously President Obama and his administration, but a lot of communication was with healthcare administrators, because we are the people who see those type of operations every single day. So yeah, you can definitely go into policymaking, but again, that is more of a political side, but you can do both for sure.
All right. So what is like some of the everyday challenges that you face, or aspiring to become a healthcare administrator, or maybe what were some of the most difficult challenges kind of deciding how you got to where you are today?
Yeah, so like I told you guys, I took that 1 year to work, right, at a hospital. And I'll be very honest with you guys. So if you're pre-med, it's a different path, it's a different experience. But with this one, I definitely recommend work experience if you're looking into this, because work experience is going to teach you things you can't learn in a textbook. And I'll be honest, it was challenging because I went into something that I didn't know, but I was curious about. Like I said, I love clinical and I love medicine. I love patient care. And I was like, when you become a healthcare administrator, you're also understanding business, which I had no background of whatsoever, besides any of the stuff I did leadership involvement in college. So I decided to go through with this, and it was a challenge. And as a healthcare admin, every day, everything is new. And that's something I've learned besides just my position, but a lot of people's positions. It's not the same routine day every day. You're not seeing, like, whereas a doctor, you're seeing patients, and yeah, each case is different. However, with healthcare administrators, you're gonna get random problems come up. If I were to give you a quick example, as a supply chain analyst, and there was only 2 of us at this entire hospital. So there was a surgery happening. I had ordered all the parts, and then the surgeon runs into my office about 30 minutes or an hour before surgery. This is not the stent I need this stent. And then I told him, I pull out the sheet, you ordered this stent. We ordered everything a week before, at least. And I was like, no, and it was identical to what he had ordered. And so this is what happens sometimes, where that organization is off, and whoever was supposed to check for the surgeon gave me the wrong stent to order, not the one that he actually wanted. The patient has already now gone under anesthesia. So it's a little late now. What are you going to do? So these type of problems happen. And my boss was out of town. My coworker wasn't there. So I was the only person running that entire department. And keep in mind, I'm like, 22 years old. old at that time. So I'm like, I don't know what I'm doing. So I call like, you have to be on your feet all the time. I called Washington Hospital, which was close by to St. Rose. Thank God they had one left. And I asked them, like, please, I will get you guys another one. I drive myself over there, go to their room, I get it, and they're looking at me like, who is this random girl? I leave, and I go back to St. Rose and I go in the OR, I dress up, I go in the OR as the surgery is just about to occur, and I hand over the set, and then I leave. And these type of things happen, and they happen all the time, and they're not talked about enough. And yeah, my hospital is a non-for-profit hospital, so a little bit maybe more common to have these type of issues because one person is wearing a lot of hats. But in healthcare admin, you're always changing. That's the cool thing about it. Parts are always moving. You're always trying to make things more efficient. So that's just an example of challenges you would face in this industry.
Wow. Besides like always being on your feet and always moving and getting things done, what do you think are like some really helpful skills or other characteristics that you could that you really need going into this field?
Yeah. So skills, characteristics wise, I would definitely say everything is always learning. You guys are always going to realize that, I'm sure, even as high schoolers, you're always going to be learning. So there's always room for improvement. But if there's a place where I would say to start, people skills are probably one of the biggest things I can tell you, besides the technical stuff you're going to have to know. People skills are really important. It's important you are willing to work with people. You have to be a team player. Even as a doctor, you must be a team player, understand where other coworkers are coming from. Otherwise, going into a professional realm, it's really hard to get your stuff done because it's not just you anymore. It's not just you in the books. It's you and your career and other people's career working together to run a system. Hospital at the end of the day is a business, unfortunately, but that's how it's viewed and that's what it is. And our customers are our patients and people's lives depend on it. So communication is number one. Number two, I would say don't be afraid to be original. Don't be afraid to have an idea and try to go into it, whether that's starting something on the side or trying to figure something out, because what makes you you is your originality. So I definitely think being original, communications, but honestly, biggest skill set is the willingness to learn. And I don't know if that's a skill set or not, but always being curious. I think it's very important to learn, whether that's shadowing, whether that's interning, even if it's something that's a day thing, it doesn't matter. Get your feet in there. And the last thing I would really say is networking. Networking is huge. You never know who's going to be out there that can definitely give you a helping hand. Because I'll be honest, at least with me, I only had one connect, but that one connect gave me a lot of connections. And then going to a school like USC and then UC Riverside, with their connections also being pretty grand in the healthcare world, UC Riverside being really big on medicine, and then USC being huge on healthcare administration, I utilized as many resources as I could. And I still do that. So I think those are some things for you guys starting out you should know.
So everything sounds like you're running here, you're running there. You have really, really busy schedule. So how do you make sure that you de-stress, that you manage your time, that you don't get overwhelmed?
Yeah, so that's still running. I'm trying to figure that out, to be honest with you. But one thing that really helps me is I use a planner. Google Calendar is my best friend. I can't imagine my life without Google Calendar. Everything is on there, including like the littlest things, like go to a grocery store. That's on Google Calendar for me. So planning my schedule out really, I think, declutters other things, because I think in undergrad, that's something I learned I wish I had done earlier. Undergrad, I started realizing the source of my stress was me just not having stuff in front of me, of knowing when things were what. So that was something that helps me. But then activities I do, some of you maybe know, but I danced at PHHS. I love dance. I love Indian dancing. I still continue to do it. I did it all throughout my undergrad as well. So I would be studying all the time, but I was also captaining a national dance team. So I was dancing every night from like 6 to 9:30 p.m. as well. And honestly, that was something that I love and I still do. So I think it's always important to prioritize yourself. And for me, meditation works. I do it every day. So that also helps.